Now we're going to talk a little bit about short-term insurance. We have found a plan called the E+ plan, and this plan is for students who are attending less than 3 months. The policy does not meet the requirements of the Affordable Care Act, and it does not meet LCSC requirements for medical insurance. However, if you're studying for less than 3 months, LCSC will allow you to take a short-term insurance policy out. If you're an athlete, I'm sorry, this presentation is not for you. Please contact the Student Health Center for specific information about health insurance for athletes. As you can see from this screen, although it's a short-term plan and covers fewer services, it is a little bit more complicated to figure out which one to purchase. What we're going to do is we're going to compare it to the PGH plan for your information. Now we're going to compare the E+ plan with the PGH plan, which is the one that most international students purchase if they'll be studying for more than 3 months at LCSC. The deductible for PGH is $50. For E+, it can be between $0 and $500. You will be choosing your deductible when you purchase your plan. Coinsurance is 90% with a preferred provider with PGH and 80% up to $5,000, and then 100% up to the selected medical maximum for E+. Your medical maximum will be the amount that you choose depending on how much you want to pay for this insurance, and we'll explain more about that later. The PGH plan has an emergency room copay, which is $150. For E+, again, it's the 80% up to $5,000 and then 100% up to the medical maximum that you select. The out-of-pocket maximum, which is the most that you are going to end up paying. With the PGH plan, the most that you would pay is $5,000. With E+, again, it's 80% up to $5,000, 100% up to the medical maximum that you select. After that, you would pay unlimited after the medical maximum. So for example, if you select a medical maximum of $100,000 and your bill is $200,000, you would be paying the other half of that cost, which would be approximately $100,000. For prescriptions, PGH has a copay between $15 and $50, and for E+, you'll need to pay the cost of your prescription up front, and then you can file a claim for a reimbursement of that expense. With PGH, a doctor visit is $20. With E+, it's 80% of cost. One thing to keep in mind about E+ is that pre-existing conditions are not covered. That means that if you are pregnant or you have a condition that you're coming to the U.S. with that you have had treatment for in the past, it will not be covered under this plan. So I just used a whole bunch of words that most Americans can't even define. Let's see if I can break it down for you. Okay, so a deductible is the amount that you pay for healthcare services before your health insurance begins to pay. Coinsurance is your share of the cost of a healthcare service. It's usually figured as a percentage of the amount charged for services. So in PGH example, they're going to pay for 90%. You start paying coinsurance after you've paid the $50 deductible. The emergency copay is a fixed amount that you pay for a healthcare service, usually when you receive the service. The amount can vary by the type of service. You may also have a copay if you get a prescription filled. So again, for emergency room, it's $150. If you just go to the doctor's, it's going to be $20. So what is an out-of-pocket maximum? That's the maximum amount that you'll have to pay for the duration of your policy. So in the case of PGH, if you have an insurance bill of $10,000, the most that you're going to pay is $5,000. And with the prescription, that is just medication that's ordered by your doctor and usually go to a pharmacy to pick up. Also, what's a preferred provider? That's really important. Preferred providers are doctors or hospitals that have agreed with PGH to take their insurance. So when you go to those doctors, they're going to pay 90%. If you go to a doctor who's not a preferred provider, PGH will pay less. A few last words on preferred providers. You'll see a list of primary care doctors in Lewiston on the Visit website. A primary care doctor is a physician who can take care of most of your common medical issues. If you have a problem that's more complex, the doctor will refer you to a specialist and will coordinate your treatment with the specialist. With the E+ plan, you can choose the maximum dollar amount of the policy and your deductible. The maximum amount is the most that the insurance company will pay for your medical services. So for example, on the first one, if you select a maximum of $100,000 and your medical bills are $200,000, you'll have to pay the other half of your bill, which is going to be approximately $100,000. Remember also that the deductible is the amount that you pay before insurance begins to pay. So you can, if you pick a $500 deductible, remember that you're going to have to pay that before insurance begins to pay. If you select zero insurance, a zero deductible, the insurance will start paying immediately with your very first doctor's visit. So we recommend that you purchase the highest maximum that you can, and on this policy the highest is the $1 million, which you can see in the lower right hand corner, and we recommend that you choose a zero deductible so that you don't get caught at the doctor's office being sick and without any money. Now we're going to talk about how to purchase this insurance. You can see there's a link on the screen. You can go to that link and then you will click on Quote and Buy Plan E+, and a screen will pop up where you'll need to enter some information about where you're from and your coverage start and end dates and the number of people that are being insured. And you'll also need to put your age range in there because that will determine how much you're going to be paying. The link that you see there is also available on the health insurance page of the IPO website. Then you'll need to select your deductible and your medical maximum, and it will calculate your cost. Also, you're going to see on there that there's something called hazardous sport coverage. You can choose to accept that or decline it. If you accept it, it will raise the price of your premium, and you can see below what hazardous sport coverage entails, which is motorcycle, snowmobiling, snowboarding, and other high-risk type activities. As you are selecting your deductible, remember that we recommend that you select a zero deductible so that you don't have to pay anything at all when you go to the doctor. And we recommend that your medical maximum be at least $250,000 or more. Continue through the form by providing the requested information as far as your address and your contact information. You'll also need to list the name of a close friend or family member who would receive an insurance payout in the event of an accidental death or dismemberment. Then you're going to enter your payment information, and you're going to e-sign this form by checking the box next to the red arrow. Once you are insured, you can find more information at the Visit website, which is listed below. On that website, you're going to see the costs, what's covered, the definitions of more terms than I talked about here, also where you can find a doctor or hospital, and some information about how to file your claims. One thing about E+ is they do have some forms in English, Chinese, and Spanish. So now you know a little bit about the two new policies that we have found for you, depending on your length of stay with us at LCSC. But don't forget that there's no cost to you at all if you go to the Student Health Center. So I recommend that you go there first and then go to another doctor or a hospital if they tell you that you need to. Here's a map of some of the local clinics. The Lewis and Clark clinic is the closest, and they also have a sliding scale, which means that the cost of the services depend on your income. And they also have a pharmacy right there, which is convenient. Their hours are 8 to 6. And one thing you need to know about them is you need to establish yourself as a patient with them before you're first seen. There's also Clearwater Medical Clinic, which is open from 8 to 5. And there's Valley Medical, which is a little bit further away, but they have more expansive hours. They are even open on Saturdays. And they also have an express care center for if you were to have a slight emergency. Thanks for listening to this presentation. I hope that you found it helpful. Please let me know if you have any additional questions after you have looked at the frequently asked questions listed below. Take care.